Assalamualaikum dan selamat sejahtera. Anda bersama saya Nabilah, Khaleeda dan ini Niaga AWANI. Seperti biasa pada jam ini kita akan berikan laporan berita bisnes, kewangan dan juga ekonomi dalam termasuklah luar negara. Jadi kita mulakan dengan perkembangan ringgit di mana ringgit ditutup rendah berbanding dolar Amerika Syarikat menjelang pengumuman data indeks harga pengeluar IHBR Amerika Syarikat di tengah-tengah kebimbangan mengenai perang perdagangan, kata seorang penganalisis. Dan pada 6 petang semalam, ringgit susut kepada 4.4310 berbanding dolar Amerika Syarikat. Dan untuk pagi ini, ringgit berada pada keparas. Kalau kita boleh saya tunjukkan di sini, untuk setakat pagi ini pada 14 Mac 2025 pada jam 9.03 pagi, ia berada pada paras 4.445, menyusut sedikit berbanding semalam. Dan kalau kita nak bandingkan antara hari ke hari, kalau kita boleh buka di sini, perbandingan dalam antara hari ke hari, kita dapat saksikan pada 13 hari bulan, kalau kita boleh tunjukkan di sini. Baik, pada 13 hari bulan, nilai ringgit itu mengukuh sedikit iaitu pada paras sekitar 4.4244. Namun line atau graf itu menunjukkan graf menaik dan ini menandakan nilai ringgit itu menyusut sehinggalah mencapai paras menghampiri 4.45. Itu adalah kalau kita bandingkan antara nilai ringgit dengan $1 Amerika, dan ini adalah berikutan kebimbangan yang meninggi ataupun memuncak terhadap perang perdagangan antara Amerika Syarikat dan negara-negara di Eropah dan termasuklah China, dan itu adalah berkenaan dengan nilai ringgit. Dan seterusnya kita akan terus bergerak ke Bursa Malaysia, di mana sementara itu FTSE Bursa Malaysia KLCI, FBM KLCI muncul sebagai indeks yang mencatatkan prestasi tertinggi di rantau ini pada penutup Khamis, meningkat 1.69% apabila melantun semula daripada penurunan 5 hari dipacu oleh aktiviti membeli saham berharga rendah. Dan pada 5 petang, FBM KLCI melonjak 25.20 mata kepada 1,510.03 daripada paras penutup 1,484.83 pada Rabu. Dan untuk pagi Jumaat ini, FBM KLCI berada pada paras 1,510.03, meningkat 25.20 mata dan 1.70%. Kalau kita boleh tunjukkan dalam jangka masa seminggu, kita dapat saksikan graf itu menurun dengan agak ketara pada permulaan pada minggu ini, iaitu pada hari Isnin. Kita dapat saksikan nilai ataupun paras Bursa Malaysia itu mencecah 1,550. Namun memasuki hari Selasa, Rabu dan kadar terendah ada pada hari Khamis iaitu sekitar 1,484. Namun memasuki hari ini, hari Jumaat, ia meningkat sedikit sehinggalah mencapai ke paras tahap 1,510, kembali ke melepasi pasaran ataupun melepasi rintangan 1,500 untuk setakat hari ini pada hari Jumaat. Dan itu adalah serba sedikit berkenaan dengan perkembangan ringgit di Bursa Malaysia untuk hari ini. Dan seterusnya kita akan teruskan dengan perkembangan antarabangsa berkenaan dengan pasaran di Amerika Syarikat, dan di mana kita akan teruskan berkenaan dengan Wall Street ended sharply lower on Thursday and the S&P 500 confirmed it is in a correction after cool inflation data was overshadowed by fears that the escalating Hydra-headed tariff war being waged by the United States against its biggest trading partner could reignite inflation and tip the economy into recession. A broad sell-off sent all 3 major US stock indices tumbling, with losses in tech and tech-related mega-cap shares dragging the Nasdaq down most. The S&P 500 closed more than 10% below its February 19 record closing high, confirming the bellwether index has been in a correction since then. The S&P 500 lost 1.39% to end at 5,521.52 points, while the Nasdaq Composite lost 1.96% to 17,303.01. The Dow Jones Industrial Average fell 537.36 points, or 1.30 points, to 40,813.57.
Today in the markets, it's concerns about the debt ceiling and the negotiations related to keeping the government open and functioning. That continues to be a kick the can scenario that I feel like we have to deal with every 6 to 9 months. And we are yet again having this discussion after having kicked the can at the end of last year. Despite softer CPI and PPI numbers than expected, showing that tariffs haven't necessarily had a inflationary impact yet. There's still concern about the uncertainty of policies and the speed of which the Trump administration is moving related to both DOGE and tariff policy. It's hard to suggest that we're in a bear market or could be entering a bear market when the economic conditions aren't deteriorating in a way that would suggest that we are moving in that direction.
On March 6th, the Nasdaq confirmed it is in a correction by closing 10.4% lower than its all-time closing high reached on December 16th. In the latest episode of Trump's multi-front trade war, the European Union responded to blanket US tariffs on steel and aluminium by imposing a 50% tax on American whiskey. In the latest episode of Trump's multi-front trade war, the European Union responded to blanket US tariffs on steel and aluminium by imposing a 50% tax on American whiskey exports, prompting the president to threaten on Truth Social to charge a 200% tariff on imports of European wines and spirits. A Reuters and Ipsos poll of Americans conducted March 11 till 12 showed that 57% of poll participants believe Trump's moves to shake up the economy are too erratic, and 53% think the tariff war will do no harm than good. The Labour Department's Producer Price Index (PPI) appeared to echo Wednesday's CPI data, with cooler than expected readings appearing to confirm inflation remains on its meandering path downward as it approaches the US Federal Reserve's 2% annual target. This, along with a tame jobless claims report, provided some assurance that, for now, inflation is headed in the right direction and the labour market is on solid footing. Markets were also eyeing the ongoing wrestling match on Capitol Hill as lawmakers scrambled to pass a stopgap spending bill ahead of a fast-approaching deadline to avert a partial government shutdown. All right, now let's take a look at the latest overview of the S&P 500 index as of this morning. As you can see, it's a sea of red with spots of green, and red means losses and green means gains. So it means that the market is mostly down with a few stocks holding on. So I'm going to start with the update on Tesla. It shows a red color here, and it was down by 2.99%. It stood at the points of 240.68. And the latest updates on Tesla is US automaker Tesla has warned that it and other major American exporters are exposed to retaliatory tariffs that could be leveled in response to President Donald Trump's aggressive use of tariffs. Tesla CEO Elon Musk, a close ally of Trump, has been leading the White House effort to shrink the size of the federal government and the billionaire heads of the so-called Department of Government Efficiency. And stay up to date with the latest news, trends and innovations that are driving the global automotive industry with the Reuters Autofile newsletter. And the letter reflects comments by many US businesses concerned by Trump's tariffs and is notable because it is from Tesla. It is not clear who wrote the letter, which is unsigned but is on company letterhead. And Tesla said it is important to ensure that Trump administration's efforts to address trade issues do not adversely harm US companies. It said it was eager to avoid retaliation of the type it faced in prior trade disputes, which resulted in increased tariffs on electric vehicles imported into countries subject to US tariffs, and that's on Tesla. But the latest updates on Apple, as you can see, it shows the color of red as well, same as Tesla, and it was down by 3.36% and stood at the points of 209.68. And the latest updates on Apple is planning a new AirPods feature that would allow the device to translate conversations with people into another language. Bloomberg News reported on Thursday, citing people with knowledge of the matter. And the feature will be offered as a part of an AirPods software upgrade later this year, the report said, and will be tied to the iOS 19 update to its mobile operating system. The Technology Roundup newsletter brings the latest news and trends straight to your inbox. To sign up, you can just go to Apple website, and Apple did not immediately respond to a Reuters request for a comment. And the company had last year said its AirPods Pro 2 can be turned into a personalized hearing aid via software updates. All right, moving on to another updates. We have Tesla and Apple earlier, but moving on, we want to show you on General Motors Company or GM shows sort of a maroon color. It was down by 1.65% and stood at a level of 47.11 points. And that's General Motors, where President Donald Trump met with General Motors CEO Mary Barra on Wednesday to talk about the automaker's investment plans amid an ongoing trade war, a White House official told Reuters. And last week, Trump agreed to exempt automakers from his punishing 25% tariffs on Canada and Mexico for 1 month as long as they comply with existing free trade rules after a call with Barra Ford CEO Jim Farley and Stellantis chair John Elkann. Trump told reporters on Thursday that GM had visited on Wednesday and they want to invest $60 billion. All right, moving on to Microsoft. As you can see, it shows sort of a red color here, and it was down by 1.17% and stood at the level of 378.77 points. And the latest updates on Microsoft, SoftBank plans to transform a former Sharp LCD panel plant in Japan into a data center for operating artificial intelligence agents developed in collaboration with US-based ChatGPT creator OpenAI, according to a Nikkei report on Friday. And the Japanese telecom giant intends to purchase the facility and part of the land at Sharp's closed TV LCD factory in Osaka for about 100 billion yen. And the center is expected to start operations in 2026 and will be one of the largest in Japan, boasting a power capacity of 150 megawatts. The partnership aims to commercialize OpenAI's AI agent model in Japan, with plans to train the model on client companies' data and offer customized AI agents. The investment is expected to be significant, potentially approaching 1 trillion yen, the Japanese media outlet reported. SoftBank and OpenAI did not immediately respond to a Reuters request for comment. All right, that's all the updates for US market. We have a lot more updates after this, so we'll go for a short break. We'll be right back.
Ini mungkinlah cabaran paling sukar. Ia penuh sengsara, pengorbanan, dan semangat yang tak pernah mengalah. Di sini, juara ditempa dan legenda dicipta. All England Open Badminton Championships secara langsung di Astro Badminton dan Astro Go.
Assalamualaikum dan selamat sejahtera. Anda bersama saya Nabilah Khaleeda, dan pada waktu ini kita akan berbincangkan berkenaan dengan tenaga nuklear dan adakah Malaysia bersedia untuk mengadaptasi atau mengaplikasikan tenaga ini untuk menggantikan sebagai tenaga elektrik pada masa akan datang, dan di mana kerajaan Malaysia sedang mempertimbangkan penggunaan tenaga nuklear sebagai sumber penjanaan tenaga masa depan untuk mencapai matlamat pelepasan karbon sifar bersih menjelang tahun 2050. Dan Menteri Sains, Teknologi dan Inovasi Musti Chang Lee Kang berkata, penggunaan teknologi nuklear khususnya tenaga nuklear sendiri itu tertakluk kepada pelbagai perjanjian konvensyen antarabangsa serta resolusi Majlis Keselamatan Pertubuhan Bangsa-Bangsa Bersatu PBB. Tapi sebelum kita dapat meneroka potensi tenaga ini, Malaysia perlu memenuhi beberapa syarat penting yang ditetapkan oleh Agensi Tenaga Atom Antarabangsa IAEA, dan sekurang-kurangnya 8 protokol atau konvensyen perlu ditandatangani dan disahkan terlebih dahulu. Dan itu hanyalah permulaan, dan setakat ini Malaysia telah menandatangani dan meratifikasi beberapa protokol serta konvensyen penting. Namun persoalannya, apakah langkah yang telah diambil setakat ini dan apakah cabaran yang masih perlu diatasi bagi memastikan kita mematuhi piawaian antarabangsa ini? Jadi untuk membincangkan lebih lanjut mengenai isu ini, kita bersama dengan fellow utama dari Institut Alam Sekitar dan Pembangunan Lestari UKM, Profesor Dr. Ahmad Faris Muhammad. Assalamualaikum Prof. Mungkin pertama sekali kalau kita nak lihat bagaimana dengan menandatangani 8 protokol ini dapat kita pastikan keselamatan dan juga pematuhan kepada piawaian antarabangsa, terutama dalam konteks pengawasan dan juga pelaksanaan dasar nuklear, terutama untuk mencegah sebarang kelemahan dalam sistem pengawasaliaan mungkin, dan juga terutamanya dalam aspek ketelusan dan accountability itu sendiri. Dan kalau kita nak lihat dalam pengurusan risiko jangka panjang, bagaimana 8 protokol ini penting?
Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. keperluan untuk mematuhi protokol ini sangat penting kerana kita apabila menggunakan tenaga nuklear ataupun teknologi berkaitan nuklear ini, perkara kepatuhan antarabangsa sangat penting. Dan ia penting kerana ini ada satu teknologi yang bukan mudah untuk dibina dan juga bukan mudah untuk diurus dan selenggara. Dan dia akan melibatkan bukan saja kos wang ringgit, tetapi ia akan memberi implikasi yang negatif kepada alam sekitar dan juga manusia jika tidak diurus dengan baik. Keperluan untuk mematuhi protokol-protokol yang berkaitan dengan tenaga nuklear ini sangat penting. Kerana tanpa kita patuh, kita akan ada masalah besar jika berlaku insiden-insiden yang tidak diingini. Dalam keperluan ini, kita kena faham bahawa tenaga nuklear ini bukan sahaja untuk keperluan awam, malahan ia mungkin dilihat dalam konteks untuk keperluan ketenteraan. Jadi protokol-protokol ini perlu dipatuhi kerana negara Malaysia bukanlah sebuah negara yang besar dan ia perlu adil pada semua negara-negara lain kerana penggunaan tenaga nuklear ini implikasinya akan bukan sahaja dalam bentuk positif di mana memberi tenaga yang berterusan, tapi jika tidak diurus dengan baik, kita akan ada masalah besar, terutamanya kepada impak kepada kesihatan manusia itu sendiri dan juga kepada alam sekitar di masa depan. Dan dalam konteks ini, ya,
silakan. Teruskan, Prof.
Dalam keperluan ini, kalau kita tengok protokol-protokol yang telah diwujudkan di peringkat antarabangsa itu, dia memerlukan sebuah negara yang untuk menggunakan tenaga perlu patuh kerana bukan saja impaknya jika berlaku insiden, bukan saja kepada negara itu sendiri dan ia akan memberi kesan kepada negara-negara jiran dan ini akan jadi memberi kesan yang tidak baik kepada negara di masa depan kalau kita tak patuh kepada protokol-protokol yang berkaitan.
Dan seperti Prof katakan, 8 protokol ini penting untuk kita patuhi untuk memenuhi piawaian di peringkat antarabangsa dan juga supaya kita tak memberi kesan kepada negara-negara jiran. Dan kalau kita lihat, selain daripada 8 protokol ini, kerajaan juga sedang mengkaji Akta Pelesenan Tenaga Atom 1984 dan di mana kalau kita nak lihat juga antara cabaran utama yang perlu kita mengambil perhatian untuk kita selesaikan terlebih dahulu sebelum Malaysia memulakan pembangunan tenaga nuklear ataupun melaksanakan undang-undang baru bagi memastikan pematuhan itu berkesan ataupun sejajar dengan 8 protokol itu sendiri. Mungkin apa cabaran lain, Prof?
Okey, apabila kita melihat akta yang sedia ada, sebenarnya ia sudah lengkap bagi saya. Tetapi bila kita bergerak ke arah contohnya kita tidak pernah ada loji tenaga nuklear lagi di Malaysia. Sedia ada adalah teknologi nuklear yang kebanyakannya digunakan untuk industri pertanian, perubatan dan juga mungkin semua industri pembuatan dan perubatan. Tetapi bila kita nak ada loji tenaga nuklear dengan berskala besar, jadi undang-undang ni perlu ditambah baik dalam konteks pelbagai. Kalau antara perkara penting yang kita perlu beri perhatian adalah dalam aspek pengurusan dan penyelenggaraan loji itu. Pengalaman seperti Chernobyl dan Fukushima ada dua pengalaman yang memerlukan akta ini diperhalusi. Sebab kalau kita lihat di Fukushima, negara Jepun menyimak semula balik kaedah-kaedah tertentu dalam mengawal insiden. Kita kalau boleh tak adalah berlaku insiden, tapi ia adalah satu langkah-langkah yang perlu ada. Jadi contohnya lagi ialah nak tambah baik ialah pembelian sumber, contohnya uranium dengan berskala besar. Sekarang ni di Malaysia pembelian radioaktif berskala kecil. Jadi adakah ia sesuai atau tidak dalam keperluan itu? Dan kita perlu lihat juga dalam konteks keselamatan mengenangani dan mengurus semua sumber ini semasa dia dibawa daripada luar negara sampailah ke loji. Dan juga dalam konteks itu sumber manusia itu sendiri, macam mana kita nak pastikan mereka patuh dan sebagainya. Sebab ini adalah perkara baru di Malaysia. Jadi undang-undang yang sedia perlu disemak untuk menambah baik bagi memastikan apabila kita bergerak ke arah tenaga nuklear, terutamanya membina loji tenaga nuklear yang besar, dia memerlukan perubahan bagi memastikan apa yang dilaksana dan diurus dan juga operasi loji itu tidak memberi implikasi yang besar. Itu pandangan saya dalam konteks undang-undang tadilah.
Dan betul kita masih di peringkat awal, masih peringkat orang kata pemikiran ataupun proses rangka kerja itu. Tapi kalau sekiranya 8 protokol ini telah diratifikasi dan juga telah ditandatangani, berapa lama jangka masa yang diperlukan untuk melaksanakannya? Itu soalan pertama. Dan kalau kita lihat dalam belanjawan yang terakhir tahun lalu, Oktober 2024, kita dapat saksikan peruntukan yang berkaitan dengan teknologi nuklear mesti telah menerima peruntukan sebanyak 195 juta ringgit, menjadikan jumlah keseluruhan sebanyak 595 juta ringgit. Soalan saya, adakah peruntukan ini cukup untuk termasuk melatih lebih ramai pakar dalam bidang tenaga nuklear ini, menjalankan pendidikan serta pembangunan R&D, dan juga apakah mungkin jika risiko Malaysia terus menangguhkan keputusan ini, kerana sekarang kalau kita lihat kerajaan masih mengambil pendekatan berhati-hati untuk mengaplikasikan tenaga nuklear?
Tenaga nuklear ini sebenarnya pelaburannya sangat besar. Bukan ratus juta, mungkin bilion. Sebab dia adalah satu pelaburan yang memerlukan satu pelaburan yang sangat besar kerana ia penggunaannya itu. Kalau kita lihat penggunaannya untuk kata bekalan tenaga untuk kawasan industri yang besar, atau ia akan mudah kerana contohnya kita lihat dalam keperluan untuk membina itu. Kawasan-kawasan ni bukannya kawasan yang kita boleh pilih begitu. Kita perlu kawasan-kawasan yang selamat dan ini menyebabkan kos. Itu belum lagi kita nak bina loji. Loji pula bukan oleh kerana pengalaman insiden yang seperti Fukushima dan Chernobyl menyebabkan negara-negara yang nak bina loji ini, mereka memerlukan teknologi yang pastikan ia selamat. Dan teknologi dan yang selamat ini bukan murah. Ya? Bagi saya kalau 500 juta yang ada tu hanya mungkin cukup untuk bina bangunan atau infrastruktur, tetapi operasinya memerlukan kos-kos lain. Itu baru kita melihat dalam konteks koperasi. Kemudian dari sumber manusia yang pakar. Ini satu perkara yang penting. Kalau kebergantungan kita lebih berat kepada pakar luar, kosnya akan meningkat dan akan memberi implikasi yang besar dalam proses kewangan. Dan kalau boleh, dalam untuk operasi, lebihkan pada pakar-pakar tempatan. Ini akan boleh mengurangkan kos dalam konteks operasi. Itu dalam konteks operasi. Belum lagi kita nak tengok kos untuk pelupusan sisa radioaktif ini. Sebab sebenarnya dia ada tempoh. Mungkin 20 tahun, 30 tahun. Selepas itu, kita nak letak kat mana. Kos pelupusan pun sangat tinggi sebenarnya. Bukan murah. Kalau tak silap saya, Institut Nuklear kita di Bangi dan Sepang, mereka ada 2 tapak pelupusan yang mana kos membinanya sangat tinggi. Ya, jadi pelaburan itu memang banyak sebenarnya untuk loji tenaga nuklear ni kalau nak ikutkan, dan juga bukan perkara yang mudah. Dan negara mengambil sikap berhati-hati kerana kita perlu ingat kewangan negara sekarang bukanlah hanya untuk nuklear saja, ada perkara-perkara lain yang mungkin boleh kita fikirkan, dan ia bukannya perkara yang boleh dimasukkan begitu saja kerana tanpa penilaian risiko. Risiko ni bukan saja kepada kesihatan dan manusia dan alam sekitar, tetapi juga risiko dari segi timbal balik pelaburan itu. Adakah ia akan memberi keuntungan yang sekurang-kurangnya tidak membebankan kerajaan, swasta yang terlibat dan juga kepada rakyat. Yang ini kita kena berhati-hati. Dan kos untuk bina loji sekarang agak tinggi. Sudah tentulah kalau kita tunggu lambat lagi tinggi. Namun bagi pandangan saya, tenaga nuklear ini kita perlu hati-hati sebab implikasi yang akan berlaku pada jika berlaku apa-apa yang tidak kita mahu, ya, insiden ini akan memberi kesan yang meluas sebenarnya.
Dan selain kos yang tinggi, jangka masa yang diambil untuk pembinaan itu sendiri mengambil lebih kurang 12 hingga 15 tahun. Itu jangka masa yang lama sebenarnya. Itu baru pembinaan, belum pelaksanaan lagi. Jadi kalau kita nak mengambil kira pada khidmat Prof, kalau mengambil kira penjimatan tenaga dengan menggunakan tenaga nuklear ini, adakah ia benar-benar boleh menggantikan tenaga yang kita guna sekarang iaitu arang batu dan gas, atau kita masih lagi akan bergantung kepada dua ini dalam jangka masa akan panjang nanti, Prof?
Saya berpandangan bahawa bagi keperluan untuk sumber tenaga perlu dipelbagaikan. Di Malaysia ni inisiatif untuk tenaga solar bergerak pantas. Cuma ia perlu diperluaskan. Dan kita juga boleh melabur dalam tenaga angin. Tetapi mungkin sesuai di Sabah dan Sarawak kerana kesesuaian di situ. Dan kepelbagaian ini juga tenaga nuklear boleh masuk tetapi tidak boleh jadi dominan atau yang utama. Kerana kita kena ingat dia ada risiko yang sangat tinggi. Kalau tak silap saya, negara China semuanya, dia dah kurangkan kebergantungan kepada tenaga nuklear. Mereka sudah lebihkan kepada solar dan juga tenaga angin. Dan malah negara-negara Eropahnya, kalau tak silap saya, sudah negara Jerman, apabila mereka memberhentikan loji-loji baru, mereka sudah bergerak kepada tenaga angin dan solar. Di sini, saya setuju kebergantungan kepada arang batu perlu diberi perhatian sebab lombor-lombor arang batu di dunia sekarang berkurang dan ia tidak menjadi satu keutamaan di masa hadapan. Namun kita ada alternatif lain. Kita boleh kekalkan lagi kita punya sumber tenaga daripada hidro, tapi kita pelbagaikan dalam sumber-sumber tenaga yang risikonya lebih rendah berbanding dengan nuklear ni. Sebab nuklear ni dia ada isu-isu yang kalau kita tak berhati-hati akan memberi bukan saja kepada kita sebagai rakyat Malaysia tetapi juga kepada rakan-rakan di sekitar kita.
Prof, kita ada lebih kurang 1 minit. Selepas ini kita akan mengkaji ataupun mengambil kira berkenaan dengan kos pelaburan awal loji nuklear yang Prof sebutkan tadi yang sangat tinggi, dan ada beberapa negara juga telah membatalkan sebenarnya projek nuklear kerana kos yang sangat tinggi seperti contoh Jerman, di mana kalau kita nak mengambil kira Malaysia juga yang sebelum ini ada beberapa projek yang telah dibatalkan kerana terlalu optimis ataupun orang kata terlalu bercita-cita tinggi, dan kos berlebihan ini berkenaan dengan projek infrastruktur akan menjejaskan lagi pembangunan ekonomi dalam jangka masa panjang. Tapi itu akan kita bincangkan selepas ini. Jadi kita akan berhenti rehat seketika, kembali selepas ini.
Uniform Tentera Darat Malaysia TADM bagi peserta program latihan khidmat negara tidak seharusnya menjadi isu hangat.
Jenayah penipuan pelaburan mencatatkan jumlah kerugian tertinggi pada tahun ini setakat 2 Februari lalu.
Kementerian Pendidikan memandang serius isu peningkatan trend penggunaan rokok elektronik.
Lembaga Lebuhraya Malaysia LLM memperluaskan larangan kenderaan berat memasuki lebuh raya pada waktu puncak di beberapa jajaran terpilih di sekitar Lembah Kelam.
Baik, bertemu kali kita masih lagi dalam perbincangan berkenaan dengan tenaga nuklear dan sejauh mana kesediaan Malaysia untuk mengaplikasi ataupun merealisasikan aspirasi kerajaan ini, dan kita masih lagi bersama dengan Profesor Dr. Ahmad Faris, dan di mana kalau berbalik kepada soalan saya sebelum berhenti rehat tadi berkenaan dengan kos yang tinggi untuk melaksanakan projek ini. Jadi persoalannya adalah adakah bagaimana mekanisme ataupun strategi terbaik yang perlu dijalankan ataupun dilaksanakan oleh kerajaan supaya impian ini ataupun matlamat untuk menggunakan tenaga nuklear ini dapat dijalankan secara bertanggungjawab dan juga efektif, Prof.
Bagi kita untuk laksanakan penggunaan loji tenaga nuklear di Malaysia ini, ada beberapa perkara yang perlu menjadi teras untuk kita ada. Pertama ialah kesediaan sumber yang penting, utamanya uranium yang boleh dibeli dengan harga yang mampu bayar. Ini adalah satu perkara yang penting sebab di mana kita boleh dapatkan sumber uranium ni. Kalau di dunia ni lombong-lombong yang menghasilkan uranium sudah berkurangan dan harga dia sangat mahal. Kedua tadi kesediaan dana Kemudian sumber manusia itu. Kesediaan sumber manusia itu perlu ada. Jadi ia perlu dipikirkan dalam konteks yang lebih luas, bukan untuk jangka pendek, dia mesti jangka masa panjang. Sebab loji tenaga nuklear ni kita perlu bukan satu generasi je, mungkin 2 atau 3 generasi. Jadi kesediaan sumber manusia pakar itu perlu diberi perhatian dan mana ia memberikan implikasi jika kita ingin melabur dalam loji tenaga nuklear di masa depan. Dan kesediaan kawasan. Kawasan-kawasan di Malaysia ni, kalau di semenanjung Malaysia, Sabah dan Sarawak ni, kita kena berhati-hati kerana kita ada juga tanda tangan beberapa convention, terutamanya kepelbagaian biologi, yang mana kawasan-kawasan hutan kita sebenarnya tidak boleh dibina loji tenaga nuklear sebenarnya kalau kita dah kita panggil gazetkan kawasan itu sebagai hutan simpan kekal. Ini kita kena hati-hati kerana komitmen Malaysia dalam konteks kepelbagaian biologi sangat tinggi. Dan kemudian kesediaan swasta untuk bersama kerajaan untuk melabur. Dan ini ada sangat penting. Dan dalam konteks keperluan itu, kita perlu perhatikan bahawa kesediaan perkara-perkara ini akan memberikan satu pandangan yang kritis dalam konteks kita untuk mempunyai satu loji tenaga nuklear di masa hadapan. Jadi saya bersetuju dengan kerajaan apabila mereka pihak kerajaan utamanya Kementerian Sains dan Teknologi dan Inovasi berhati-hati dalam konteks ini. Kerana ia bukanlah satu perkara yang mudah dalam konteks kita untuk membina satu loji tenaga nuklear. Dan kawasan itu juga memberikan implikasi sebab kalau dari sudut pandangan masyarakat, tidak ada yang mahu mereka duduk di sebelah loji tenaga nuklear. Negeri-negeri yang padat seperti Selangor, Pulau Pinang, Negeri Sembilan, Melaka mungkin tak sesuai. Jadi di mana kita nak letak loji itu satu perkara yang perlu difikirkan. Dan kalau kata mungkin kita perlu lihat dalam konteks satu teknologi nuklear yang boleh menghasilkan tenaga dalam kawasan yang kecil katakan. Ataupun berbentuk mobile katakan. Tapi itu pun ada isu-isu yang perlu diberi perhatian supaya tidak memberi implikasi yang negatif nanti di masa depan.
Dan itu adalah antara beberapa orang kata kekurangan, di mana kalau kita nak lihat antara cabaran yang telah dikenal pasti adalah seperti kekurangan uranium, kekurangan sumber manusia, kekurangan kawasan juga terutama dengan penduduk yang padat dan juga kesediaan swasta untuk bersama kerajaan untuk melabur. Namun saya akan memberikan fokus kepada berkenaan dengan kekurangan sumber manusia itu. Prof, itu penting untuk kita mengambil perhatian kerana kalau kita lihat Malaysia kini masih kekurangan dalam bidang tenaga nuklear dan peringkat tertiary juga, pendidikan tertiary, hanya beberapa universiti seperti UNITEN dan juga UKM yang menawarkan kursus berkaitan nuklear. Jadi persoalannya, adakah sistem pendidikan di Malaysia ini cukup bersedia berkenaan dengan tenaga nuklear dan mungkin bagaimana Malaysia perlu bergantung, adakah kita perlu bergantung pada tenaga luar semata-mata dan mungkin apa strategi yang terbaik untuk kita cukupkan tenaga kerja itu terutama berkenaan dengan tenaga nuklear ini, Prof?
Dalam konteks kesediaan sumber manusia pakar, sebenarnya IPT di Malaysia perlu lihat dalam keperluan yang luas. Apabila sesebuah loji itu dibina, bukan saja pakar yang faham dalam konteks sains fizik nuklear, tetapi dia ada kumpulan daripada pelbagai bidang. Terutamanya kejuruteraan awam, kejuruteraan mekanikal, kejuruteraan elektrik, ya, dan bidang-bidang itu yang menyokong. Asas dalam konteks pendidikan dalam bidang kejuruteraan itu sudah ada di Malaysia, tetapi kita perlu ada satu entiti yang boleh memastikan sumber air manusia yang berminat atau dipilih ini bergerak untuk menyokong kepada inisiatif tenaga nuklear di Malaysia. Sebabnya sekarang ini graduan universiti apabila mereka keluar, mereka tidak bergerak ke arah tenaga kerana tidak ada lagi di Malaysia. Malahan penggunaan teknologi nuklear di Malaysia ini tidak banyak yang tahu. Kerana contohnya kita tengok radiologis. Radiologis ni dia ada fizik ya. Mereka penggunaannya tidak banyak, hanya pada hospital-hospital tertentu yang ada menggunakan teknologi nuklear dalam sistem radiologi mereka. Dan ditambah pula kalau dalam konteks keperluan sumber lain seperti kesihatan dan perubatan, kita sudah ada. Cuma yang kalau betul negara nak bergerak sana bagi keperluan sumber manusia, entiti yang ada nanti yang mungkin agensi tertentu, contohnya atom ataupun MIN, perlu ada satu sistem dan mekanisme memastikan sumber manusia ni disediakan. Tapi di sini dia balik-balik macam ayam dengan telur lah tadi, nak mula bila. Kalau sekarang ni, kalau kita pelbagaikan lagi industri-industri yang menggunakan teknologi nuklear ini lebih meluas, di situ kita sudah ada pakar di bidang untuk tempatan. Seperti yang saya kata tadi, kalau kita bergantung pada tenaga luar, kosnya sangat tinggi. Kena ingat contohnya kalau kita mengambil satu jurutera yang berasal dari Jerman katakan, kita kena bayar gaji mereka dalam nilai mata wang mereka. Yang ini akan meningkatkan kos. Contohnya lah kan. Tapi jurutera untuk teknologi nuklear ini tidak ramai sebenarnya di Malaysia. Jadi oleh kerana tidak ada keperluan sekarang. Namun jika kerajaan betul mahukan perkara ini berlaku, dan latihan-latihan ini dan pergerakan untuk semua-semua ini perlu ada. Sebab kebertanggungan tenaga luar ni kos dia sangat tinggi.
Ya, Prof, antara isu utama kalau kita mengambil kira tenaga nuklear, kalau kita nak adaptasi atau menggantikan tenaga-tenaga yang kita guna pada waktu ini di Malaysia adalah berkenaan dengan pengurusan sisa radioaktif itu sendiri ataupun uranium. Persoalannya adalah adakah tenaga nuklear ini benar-benar hijau kalau kita mengambil kira kitaran hayat uranium ataupun sisa radioaktif itu? Contohnya adalah pelombongan uranium. Mungkin kalau Prof boleh kongsikan apa langkah kukuh ataupun konkret yang Malaysia boleh sediakan untuk menyimpan dan melupuskan sisa nuklear itu secara strategik dan mungkin yang lebih selamat dalam jangka panjang, sebab Prof ada katakan orang ramai juga takut bila dengar perkataan nuklear ni, tak nak duduk dekat dengan kawasan yang berkenaan dengan nuklear, dan sisa pelupusan juga menggerunkan mereka sebenarnya. Jadi mungkin apa penyelesaian terbaik?
Okey, apabila jika kerajaan serius untuk bergerak membina loji tenaga nuklear di masa depan, sistem dan mekanisme untuk mengurus sisa itu perlu seiring. Okey, kalau kita tengok apa yang berlaku di negara-negara yang menggunakan lokasi untuk pelupusan sisa radioaktif atau nuklear ini tidak berada di kawasan penemuan, dia sangat jauh. Kalau di Amerika, di Eropah memang jauh sana. Sebenarnya mereka berada di bawah tanah ataupun mungkin dalam gunung. Bayangkan kenapa mereka nak bina tapak kawasan-kawasan pelupusan ini berada di dalam kawasan-kawasan yang jauh dari penempatan dan berada sebab mereka tahu jika berlaku kebocoran atau insiden tertentu akan memiliki implikasi yang besar. Itu tempatnya. Kalau kita tengok protokol yang digunakan untuk melupus sisa ni, dia bukan mudah. Contohnya kalau kita saya ingat lagi masa saya melawat min, nak lupus katalah 500 gram sisa radioaktif uranium, mereka perlu letakkan dalam satu ruang yang lapisannya tebal dan ada konkrit pula. Jadi ini adalah satu perkara protokol yang sudah ada dan mereka boleh buat. Cuma lokasinya itu. Sebab kalau pergi bergerak ke dalam loji tenaga nuklear, selalunya kawasan ini besar. Dan pelupusannya juga memberi satu kawasan yang selamat. Jadi bukan mudah sebenarnya menggunakan tenaga nuklear ni. Itu sebab negara-negara yang sudah mula menghentikan loji-loji ataupun tidak ada loji, mereka menampak isu itu. Pelupusan itu sendiri akan memberikan satu kos yang tinggi dari segi kewangan, sumber manusia dan juga alam sekitar di masa depan.
Mungkin soalan terakhir Prof sebelum kita akhirkan perbincangan kita adalah berkenaan bagaimana kita boleh belajar dari negara-negara maju yang telah pun menggunakan tenaga nuklear, mungkin dari segi pelaksanaan, dari segi dasar dan polisinya, dari segi pengurusan sisa, dan mungkin apa yang paling penting adalah dari segi persepsi penduduknya, rakyatnya tentang kebimbangan penggunaan tenaga nuklear itu sendiri, terutama kalau kita dah lihat insiden sebelum ini di Fukushima dan juga seperti yang lagi satu ialah Fukushima lah. Mungkin bagaimana kita boleh mengubah persepsi itu?
Kalau kita tengok kejadian di Chernobyl, Rusia, di Chernobyl di Ukraine, ke Rusia, sekarang di Ukraine, dan di Fukushima di Jepun, ini ada dua entiti berbeza. Yang Chernobyl ini lebih kepada kecuaian operator, manakala di Fukushima adalah agak tsunami. Kalau kita tengok Fukushima, dia ada satu loji nuklear yang sangat-sangat patuh pada protokol. Sebab budaya dan amalan kerja oleh orang Jepun ni sangat disiplin. Dia memang. Jadi di situ pengalaman tu kita boleh belajar. Tapi macam mana kita nak adaptasikan dalam Kepulauan Malaysia? Okay. Mungkin kita mampu untuk bina satu loji, tetapi budaya kerja di loji tersebut perlu ada disiplin yang tinggi. Kerana bekerja di loji ini bukanlah mudah. dia pekerja di situ beroperasi menggunakan sumber yang boleh memberi bahaya bukan pada dia saja, pada orang lain. Jadi kalau kita tengok dari situ, pengalaman tu kita boleh belajar. Namun adakah kita boleh bersedia untuk menyediakan loji itu satu, kedua memastikan bahawa mereka-mereka yang diberi tanggungjawab untuk mengurus dan operasi itu betul-betul buat kerja seperti yang protokol hendak. Yang ini yang kita agak risaulah sebenarnya. Kalau kita budaya dan amalan kerja di Malaysia ni displaynya ada yang bagus, ada yang mungkin ada isu. Jadi dia protokol tu kita kena pastikan dipatuhi. Dan pengalaman di negara seperti China yang ada, Jepun Jepun pun sudah mula memikirkan untuk tidak ada yang baru. Jadi boleh belajar, tetapi adakah kita bersedia untuk ubah pemikiran pembuat dasar yang swasta, agensi yang bertanggungjawab dan juga menyediakan sumber manusia yang mempunyai amalan dan budaya disiplin bagi memastikan operasi loji itu tidak memberi impak dan kalau boleh tidak berlaku insiden.
Jadi disiplin adalah antara key ataupun isu utama ataupun perkara penting yang perlu diteliti dan juga mengambil kira kesan-kesannya seperti kebimbangan orang awam, kos, tenaga kerja, sumber manusia, polisi serta impak alam sekitar juga sebelum melaksanakan tenaga nuklear di Malaysia. Dan apa yang penting juga adalah berkenaan dengan pendidikan dan pembangunan R&D yang mapan dan juga orang kata menyeluruh oleh kerajaan sendiri. Jadi terima kasih diucapkan kepada Profesor Dr. Ahmad Faris Muhammad, Fellow Utama Institut Alam Sekitar dan Pembangunan Lestari UKM, dan segala perbincangan ini akan kami bawakan dalam semua platform digital AstroWani dan juga astrowani.com. Saya kira itu saja pada waktu ini perbincangan kita. Saya Nabilah Khaleeda. Assalamualaikum dan salam hormat.
Dia yang nak kata dah. Dapat dia jada buat. Dapat dia jaga buat. Ayo restu.
KAHA, Kapla High Council. Sewa dan stream on demand atau sila ke saluran 480.
Hello and welcome to Niaga Spotlight with me, Tehmina Kaoosji. Niaga Spotlight takes us through the week in economic analysis and future affairs. Now, this week on analysis, we discuss addressing depopulation, fertility after 40. Now, depopulation and demographic shifts are a topic of global economic conversations in 2025. In much of the world, fertility rates have fallen below the replacement rate required to maintain a stable population, and despite increasing longevity, some countries have already started to see population decline. Others may follow in the not-so-distant future. Now, in Malaysia, the total fertility rate, or the TFR, has declined to 1.7 births per woman in 2020, the lowest in over 4 decades, and below the replacement level of 2.1 children per woman. Meanwhile, mothers aged 30 to 39 years recorded the highest live births in the first quarter of 2024, i.e. 55,864 births, which accounts for 52.5% of all births. While mothers aged 40 years and over during the same commensurate period recorded 6,383 births, or 6.0% of overall births then. Now, this trend is influenced by socio-economic factors such as increased educational attainment and career focus among women, leading to delayed marriage and childbearing. At the same time, increased financial security and social mobility in the 40s is a reason pregnancies and childbearing among women and couples above 40 is also on the rise. Additionally, Malaysia does have a high non-communicable disease or NCD burden among adults, particularly in the 40-plus demographic, linked to, of course, lifestyle factors that are clearly documented: poor diet, sedentary behavior, smoking. Now, these health issues, along with economic pressures and delayed childbearing, contribute to an overall lower fertility rate as older adults face health-related challenges. Niaga Spotlight today focuses on key issues and strategies that are in place to improve fertility after 40 in order to support sustainable demographic and economic development in Malaysia. It's an absolute pleasure to welcome today to the studios Dr. Gayatri Mariappa, consultant obstetrician, gynecologist and maternal fetal medicine specialist with Sunway Medical Center Velocity, SMCV. joined by Dr. Ashley Cheong-Subi, consultant obstetrician, gynecologist and fertility specialist, also with SMCB. A very good morning, doctors. How are you today?
Very good morning to you.
Very good morning, everybody.
Yes.
Fantastic. Thanks so much for being here today. So perhaps I could get the ball rolling by asking Dr. Gayatri in particular. So, of course, we do know that the scenario right now is looking like there is a very unique intersection of increasing fertility among women over 40. At the same time, we have a high prevalence of all the NCDs, which are constantly a topic of discussion in Malaysia. Yeah. Dr. Gayatri, a couple of insights from you, beginning with looking at maternal and fetal health risks when we combine these two together, despite the fact that we are seeing some positives and some upticks in fertility after 40.
Okay. Excellent question to kickstart our discussion today.
Okay.
So we know that women 40 years and older, they fall in a special group of population where they are more likely to have or already have coexisting medical conditions. Like rightly you said, non-communicable disease are in a higher trend among people aged 40 and above. Mm-hmm. So non-communicable disease here would be diabetes mellitus, high blood pressure, hypertension,
that's right,
obesity, and of course Malaysia is known as the obese country in Southeast Asia. We have heart diseases, kidney diseases. So when these women with these inherent risk factors go on to embark on the pregnancy, that increases their risk more on regarding the pregnancy outcomes. So they tend to have higher risk of pregnancy-related complications, such as, firstly, difficulty conceiving,
right, in the first place.
In the first place itself, yes.
Yeah, that's right.
Then they will have there's a risk of miscarriages, pregnancies affected with babies with chromosomal or genetic problems, diabetes, high blood pressure, which is pregnancy-related, a condition called preeclampsia, having risk of blood clots, which are thrombotic events, which can be life-threatening. As they go on through the pregnancy, cesarean sections are higher, risk of bleeding during delivery is higher, and even requiring ICU admissions. So it's just not, I mean, you can get pregnant, but there are the risks that we need to be aware. So how do we better this and improve these healthcare aspects would be, these women would benefit so much from what we call a preconception counselling, or also known as pre-pregnancy counselling. So what is pre-pregnancy counselling? It is when they have a sitting down, a discussion, best done by with a maternal fetal medicine specialist or someone who is trained in high-risk obstetrics. All right, we have a discussion on what is their coexisting medical conditions. How do you optimize before you get pregnant? What are the screening tests can be done? Just let's take diabetes for an example.
Exactly. Now, of course, when we're looking at our NCDs, over 50% of adults in general do have a pre-existing NCD. Diabetes might be one of them. Yeah. So on average, let's say, are you actually seeing lots more women who are in their 40s or close to their 40s actually coming in for these preconception consultations, doctor?
We are starting to see a trend that women are taking,
right,
they are empowering, we have empowered them. There's awareness there,
yes,
but I think we still need to further increase. But there are women coming in, I want to get pregnant, I have diabetes, so how do I go about it?
Right, exactly. So being aware, so that's the first step, right?
Correct.
So once they're in that preconception consultation, what happens next in the road towards ensuring that you become pregnant and then, of course, are able to maintain a healthy pregnancy? Very briefly.
Okay, so very briefly, so just say in diabetes. So we want to ensure they have a good glycemic control,
right,
looking through their medications, the tablets they take or the insulin regimes, going through screening for any target organ damages, because we know diabetes is just not about the sugar control, but looking at it can affect the kidneys, it can affect the eyes, it can affect your heart. So, because when you get pregnant, if you have already this additional organ damages, they get accelerated during pregnancy. So it's best to optimize all this, work together with our other consultants, such as the endocrinologists or cardiologists, to have, so that we can sit and have a holistic care together on managing the woman. And, she's aware before getting pregnant.
That's right, exactly. Thanks very much for that great introduction to the entire topic, Dr. Gayatri. Now, digging a little bit deeper, Dr. Ashley, so I'd love to ask you about looking at Malaysia's healthcare system overall and also adapting fertility and pregnancy care models to be best able to serve looking at hormonal disorders among women, especially those above 40. Tell us a little bit about your experiences working with this target group.
All right, thank you for the questions. I mean, Dr. Gayatri has elaborated quite a understanding about what we have to know. As women, that you know that nowadays, working women, we are in dilemma whether, family come first or our career advancement first. So looking into that, we know that now we have working women that want to set up their family a bit later. Maybe they want to have more financially stable and then have more better support in terms of families and friends and peers around. So first of all, we want them to know, the awareness of what is a hormonal condition, like for example, PCOS, we know as polycystic ovarian syndrome, which is quite commonly seen in our fertility fields. So sometimes some ladies, they might not be aware that they have condition like PCOS, or they don't even know that they actually have a coexisting problem like diabetes, hypertension. They might think that, oh, this could be stress related or things like that. So awareness, I think early screening is also important. So if you already have the mindset of setting a family after you get married, like for example, if you are below 35 years old and probably you want to, set up family a bit later, maybe up after 35, maybe have a screening done with your partner. So I would always encourage that, couples come together. Okay, we always screen couples together to make sure that they are in good health. We screen the husband to make sure that the sperm quality and sperm quantity are at par. And then we look at a holistic condition to see whether do they have any medical problems that they want to target, or stabilize their medical issues. Like, for example, if they have some medical condition like diabetes, like even epilepsy on medication, or even they have some hypertension that need to be more controlled so that they won't affect the sperm quality or the what we call as the eggs quality.
Or the potential pregnancy in the near future. Now, it's very encouraging to hear actually that these days you actually have couples coming in together and not just the women. When did you see this shift happen? Perhaps if you're able to share with us on a timeline, and now it is taken as more of a family decision, a couple's decision, rather than the responsibility going completely on the woman to manage fertility.
I think we are doing quite well in getting all the couples out there to know that if they are less than 35 years old and they try to conceive more than a year, they should actually have a check to make sure that everything goes in the correct directions. And those women who are trying to conceive after 35 years old, if they are trying more than 6 months, then we will encourage them to walk forwards to have a check. So I think after what we call the COVID MCO, and then everyone, I do have a lot of awareness on social medias and all. So I think after after MCO, and we can see that the trend that they are always, they come together and they know the importance of coming together and give support to each other as a husband and wife. So as a couple, we would say that the support among them is important. All right. Okay. We would say that problem would not always happen just from the women's side. Okay, we want to know, yes, ovulation, part of it, how is it? We want to know the uterus condition, ovaries condition, and want to see some normal bloods investigation to see is there any deviation. So usually we do a bedside scan in my clinic, and we're going to assess the general condition of uterus and ovaries. At the same time, we also want to see the sperm analysis that we can be done in our one-stop center in SMCV.
Right. So a one-stop center, I think that actually makes things so much easier to manage from a personalized and specialized pregnancy as well as pre-pregnancy monitoring, right?
Yes. So a personalized fertility care is very important. So we look at a holistic condition where not only fertility issues, but we go into their comorbidities and the possible implication if they get pregnant a bit later, like what we say after 40. So what we say that it's not a taboo to get pregnant after 40. I think it's now we see more and more mothers they are bearing child and giving birth after 40.
That's right.
With a very specialized share care with our maternal fetal medicine specialists, with other endocrinologists, and with tertiary hospital deliveries and care. I mean, we are doing quite well on that. So just that we need the awareness and we need to investigate. We need to detect early, and antenatal care, postnatal, and the most important, the pre-pregnancy care to stabilize and to make sure that everything is at par before we embark on the pregnancy.
And of course also in the process reducing miscarriage as well as fetal development risks which naturally come with age. Yeah. Thanks for that, Dr. Ashley. So moving from there back to Dr. Gayatri. Yeah. Now looking at Malaysia within the context of the fact that we are a most multicultural society, so how do you feel healthcare providers can actually then especially tailor maternal care strategies for women over 40 to address perhaps culturally specific barriers? We're talking things like dietary practices, family structures, even access to care, which on an individual basis might actually form a barrier.
Okay. Perfect. So we do live in a very, like what you say, multicultural, various ethnicities. And let's talk about diet first. We have excellent, delicious food from north, south, east, west.
Absolutely.
All right. And so, I mean, if telling a woman, you know, she's been eating all her life staple, traditional food, and saying that you need to switch to a very healthy diet overnight, it's not going to be easy. So looking just at the households. So in the Malay households, we know that the diet used to tend to be more rice heavy with gravy. The Chinese have more noodles and soup. Indians more spicy, more oily. So, but if we can, you know, tailor fit the diet alongside working with our excellent dietitians that we have, you know, looking at the Malaysian staple diet and trying to, you know, maybe reduce, you know, portion control. There's portion control, trying to look at food which have low glycemic index. So glycemic index are the ones, are the sugar content. So especially for women with diabetes and all, we want to have a lower glycemic index. And doing that, you get more, you know, the compliance and trying to change your diet gets healthier because, I mean, frankly, going for extremely healthy or a keto that, you know, there's so much about it, it's not cheap.
Exactly. Yeah, but at the same time, I think it would actually be about whether or not that could be adapted to the daily life.
Correct, exactly.
Yeah, because I've also heard actually, you know, firsthand from friends who are also trying to conceive in their 40s that they've actually been advised against going completely 100% opposite to what their diet used to be, right?
Yes.
Would that be accurate as well? Because you can't, you've got to slightly walk a middle path when it comes to environmental and dietary factors.
Yes, I think that we have to find a balance in everything. So, you know, knowing what you can and what you should avoid. One is healthy diet. Then it's your making sure that your supplements are up to date, you know, your folic acid, your vitamin D, and then your lifestyle. Healthy lifestyle goes hand in hand, reducing alcohol intake or stopping alcohol and smoking. So all this come together. So that's in terms of diet.
Sure. And perhaps when it comes to those who are perhaps not in the demographic where they're able to come in for personalized healthcare plans, a couple of thoughts on looking at maybe community health programs, which could then prove of value to actually address the diverse needs of older pregnant women who may not necessarily come under the medical specialist demographic.
Yeah, I think like even in at SMCV, we do have programs, you know, for healthier lifestyle, healthy diet programs, which work hand in hand with our endocrinologists and our dietitian.
Right.
So they have that very catered for a special group of demographic, like you mentioned. So that will help us guide on how we can better their lifestyle and diet. Yeah.
Absolutely. Thanks for that. Dr. Ashley, I actually wanted to go and dig a little deeper into looking at specific occurrences of endometriosis and fibroids among women in Malaysia and how this actually needs to be under preconception care if women over 40 intend to conceive.
Okay, we do see nowadays, we do see more and more women who step forwards to saying that, you know, doctor, I want to check for fibroids, I want to check for endometriosis and all that. So they are aware of what is fibroid and what is endometriosis nowadays.
Right.
So we know that now public are well aware. Okay, they have this condition that might affect their fertility. So we can see that there's more gynecological routine checkup every year, or even they come in, just drop by, they say, I plan to get married soon. So I just want to check whether am I okay? Is my uterus healthy? Are my ovaries okay? And things like that. So I would say awareness is a very good thing that we are actually promoting nowadays. All right. So I think women's out there, if they are in their working life and all that, they know what is going on. All right. Secondly, is early detection of whether you have fibroids or you have endometriosis. So symptoms is also important. So when we say awareness, then they will actually know what symptoms they might have. Like for example, they have severe pain during periods, or they have bloatedness, they have enlargement in their tummy. They feel that, oh,
right,
maybe my pants is getting tighter. There's something maybe I need to be aware instead of thinking I'm fat.
Yeah, so just actually being in tune.
Yes, being in
and
tune.
I think it's an interesting intersection, and I'd like to just bring up this topic organically as well, because also around your late 30s, early 40s, there is, of course, a demographic of women who may already be experiencing perimenopause symptoms.
Yes.
So when that actually colludes with the fact that they are also perhaps trying to conceive, how do you then, get the right kind of advice medically, but also check yourself so that you are sure or you're able to identify is what you're going through perimenopause, or is it, just hormonally related?
All right. So first of all, we will do a basic ultrasound scan. All right. We will, if you're sexually active and you're married, we advise to scan from down below. We will call it as the transvaginal scan, so that to let us assess your ovarian functions, the follicles that we're going to see, and also the structure of the uterus. So in another hand, we also have some blood tests, like for example, like anti-Mullerian hormone, what we say as AMH, to assess the reserve of your ovary. And we know that when our age advances, the AMH level will get lower, and that will reduce the chances that we get pregnant. So if you get to screen all this beforehand and you know the chances that you get pregnant, and we know that maybe we can put in a bit more effort to help in terms of fertility. For example, we can suggest a IUI or even IVF to help to get you pregnant and embark in a pregnancy in a more planned and proper way. Yeah, so like some patients may ask, doctor, do I need to take out my fibroid, or do I need to do surgery on the endometriosis so that I can have a higher chance to get pregnant? I would say not all cases that we need to get you into the operation theatre. All right. So I would say personalized care, a holistic care, and we individualized plan. So maybe your fibroid is about maybe 6-7 centimeter that obstructing, the cavity, or maybe will reduce the chance of fertility, or you have symptoms like you have severe pain that you can't go to work every month when you have your periods and all that. The quality of life is not there. I would say the quality of life is so important before you embark in the pregnancy. So that will probably we go for surgery before you go towards your pregnancy care and so on after that. Because we know that fibroid in pregnancy also carries a risk in your antenatal development of the baby.
Exactly. So there are also other associated risks like placental insufficiency, obstructed labor during pregnancy. So when you are actually part of a management plan, so this will be all covered under that.
Yes,
that's correct. Yeah, because like you're saying placental insufficiency. I mean, that is it can be a lot of factors. Like, because not only structural, like fibroids and endometriosis, but the maternal health itself. Having underlying diabetes or high blood pressure or preeclampsia. So preeclampsia is this condition that we hope to get this awareness out there, that it's it's a disease of the placenta. So the placenta is the afterbirth, that connects the baby to mom. So if you have a abnormal placentation from the start of the pregnancy, that puts you at risk, to have small babies, early deliveries, high blood pressure, can affect up to, fluid collection, retention in the lungs, and, even a seizure. So doing all this by screening early in the pregnancy, then, knowing how things are, you can better plan and you intervene early. By just
and particularly, of course, any stressors, particularly during a pregnancy, given the age factor of anyone who is over 40, then, of course, it multiplies, right?
Yes, correct, definitely.
All right.
Prevention is better than cure. So, of course, some supplements that actually come into point as well to prevent the severity of the disease.
And to manage it as well.
Yes.
Right. Well, thank you for the conversation so far. Most interesting, of course, but we'll take a short break. Don't go anywhere. We'll be right back with Niaga Spotlight, still discussing addressing depopulation via fertility over 40. See you.
Uniform Tentera Darat Malaysia TADM bagi peserta program latihan khidmat negara tidak seharusnya menjadi isu hangat.
Jenayah penipuan pelaburan mencatatkan jumlah kerugian tertinggi pada tahun ini setakat 2 Februari lalu.
Kementerian Pendidikan memandang serius isu peningkatan trend penggunaan rokok elektronik.
Lembaga Lebuh Raya Malaysia LLM memperluaskan larangan kenderaan berat memasuki lebuh raya pada waktu puncak di beberapa jajaran terpilih di sekitar Lembah Kelam.
Arsenal tidak akan mengalah sehingga whistle penamat ditiup. Namun, musuh lama berbaju biru sedia memusnahkan impian mereka. Mampukah Arsenal bertahan ke penghujungnya? Segalanya bakal terungkai secara langsung. Arsenal menentang Chelsea di Premier League. Saksikan secara eksklusif di Astro.
Welcome back to Niaga Spotlight, still with me, Tehmina Kaoosji, and today, of course, we are discussing addressing depopulation via fertility over 40. Dr. Gayatri, so now going back into some emerging best practices, though, looking at monitoring and managing fetal development in women over 40, let's look at environmental stressors and factors such as air quality and urbanization in particular. So this, of course, actually does play a part in whether or not pregnancies over 40 will actually be stable, successful, and of course result in a healthy outcome. Tell us more.
All right. So urbanization is when, that's what's happening here in this part of the world, in Malaysia. So when there's a lot of changes that happens in a woman's life, from work to going out and, being exposed to the outside world, there's a lot of things that we could try to adjust from lifestyle modification. What is lifestyle modification? It's not only purely dietary. It's, going out, having proper exercises, healthy exercises, making sure you're well and fit. And they also about air pollution. You're talking about exposure to so much of, chemicals and smoke. So maybe we could consider limiting the time that you actually are on the outside, getting filters, or most important is smoking, exposure to secondhand smoking. So reduction of that could assist and help with those conditions.
Right, exactly. Yeah. Dr. Ashley, in your perspective as well, particularly because you focused on more of a holistic outlook and also looking at couples who are trying to conceive, not just the women, what happens in the case of those who are actually within a domestic situation whereby you live with a smoker? So secondhand smoke is definitely a causation and a possible risk factor, right? How can that be addressed holistically?
All right. So like smoking, we know that it's very bad for general health, all right, your lungs, all right. So, but of course, we do see that patients who come with infertility, and we know that some of them have, they are smoker or they are secondhand smoker, exposed to secondhand smokers. So we see the quality of their sperms reduce. All right, this in quality forms and in quantity of the sperm is reduced as well. So we see that smoking is one of the tremendous,
triggers, perhaps,
culprit behind it. All right, we know that if we advise them to stop smoking or even reduce smoking, and even vaping actually do affect the quality of sperm. Patients who comes with some male infertility with some affection in the sperm qualities and quantity, we say you stop smoking for a few months and start with some supplements to enhance, supplements that contain zinc, selenium, all right, CoQ10, that some will actually try to improve the production and quality and quantity of sperm, and that will actually enhance the chances of getting pregnant as well.
And does that actually then, in your experience with cases that you worked on, then act as the push for either quitting or reduction?
Yes.
Because in a couple of months, you're able to see measurable outcomes, right?
Yes. I do see in certain patients who they actually stop smoking and they improve their quality of life, they modify their lifestyle by, if we say that in country, I mean in city like KL with stress at work, unbalanced diet, the timing of having their meals are actually disrupted. All this actually cause a lot of stress to your body. And this indirectly or directly actually affects the quality of gonads, irregardless sperm. Sometimes you know that the oocytes, the eggs that we retrieve during our IVF treatment, we do see that those patients who has a lot of stress with their unbalanced diet, with smokings and all that, it affects the quality of eggs and it affects the quality of embryo. And
so that's one part of the lifestyle factors arena. Yep. Dr. Gayatri, asking you about looking at perhaps emerging best practices, and are we at this moment in Malaysia already incorporating any sort of remote or IoT-based monitoring solutions when it comes to high-risk pregnancies?
Okay, so yes, we are. We do have very good emerging best practices. So let's split into, because the pregnancy care used to be a pyramid. But now we have tend to have it an inverted pyramid, so where we give more importance at the early point of pregnancy, where from the first trimester, as early as looking, having frequent follow-ups, scans, early screening. Why is it essential that the early you screen, you can intervene and you can re-stratify the pregnancy so that things go smoothly along the way. So, for example, for both, we don't only look at the baby, we look at mom and baby. So firstly, again, with women more than 40 years old, they are at risk of having miscarriages. So knowing where the pregnancy is, and also they are 3 times more likely to have an ectopic pregnancy, which is pregnancy
3 times
outside.
more likely.
Yes, than a woman who is about 20 to 25 years old. Yeah, that is worldwide statistics that says that. So knowing where the pregnancy is, that's in the womb, whether you can relate for a miscarriage, and that's what we do in the early scans. We also look at scanning the baby, where, they say we do an NT scan looking at the fluid behind the neck of the baby. So these are all screening for chromosomal disorders for the baby. Besides that, what we also do is, like I mentioned, preeclampsia. How do we predict so early? Because this is a disease or condition that happens after 20 weeks, the second half of the pregnancy.
That's right.
But what can we do early is we do a Doppler ultrasound. So when we're scanning the baby, all I have to do is move to the side, look at the vessels that supplies the womb, and look at the flow. So if the resistance is high, then and then there are a lot of calculators, and we re-stratify and risk calculators to stratify, and we say, okay, this mom is at high risk. So we have to we start with a supplement called aspirin, not the painkillers that we have, but aspirin. Okay. The dose is about 100 milligram initially, then to 150 milligrams. Right. You take it daily at night, and that reduces your chance of preeclampsia by 82% by 34 weeks. So that is a big number, because
very significant. Yeah, 82%. All right.
Yeah, and you're talking about preterm delivery, small babies, because again, that comes into the economic front, where having a baby in the neonatal ICU for not a week or 2, but sometimes some babies end up staying to 2 to 3 months.
That is a considerable financial drain on
Yes,
families.
Correct. So just a medication can reduce that risk. So then we go on to screening throughout the pregnancy. So we know her risk, and just say she has, then we screen for diabetes. If she never had a chance to attend a preconception counseling, we can take this opportunity to look for diabetes, any thyroid disorder. Usually they're hypothyroid, where their thyroid levels are lower, and then for any kidney disease, so that we can start medication early and treat. And then as the pregnancy goes, you have close monitoring, looking at the baby's growth, looking at the mom, her blood pressure, her weight gain, and then for delivery. Yeah. But I think what I want to bring to the attention is, we know about practices during pregnancy, but the 4th trimester, which is the postpartum, is the most essential. So imagine having a new mother with a baby, struggling, with breastfeeding, trying to lead a near to normal life, and having a lot of mental stress from out there, and coping herself. So what does she do? She neglects her
own well-being.
Her own well-being is neglected. So, but that will have implications in later life, because if you have preeclampsia during pregnancy, you're at risk 4 times to have heart disease and hypertension later in life. Correct.
Understood.
So, as the healthcare professional, as maternal fetal medicine, fertility consultants, obstetricians, we should try to continue her follow-up after delivery, and she have a transition over to her general practitioner, to the clinic kesihatan, or the, like the endocrinologist or cardiologist. So there's an onward care. So I think the post-delivery follow-up and care is also very essential in these women. We can't just let go.
Thank you. Thanks very much for that, Dr. Gayatri. I love the fact that you emphasize on the 4th trimester per se. Dr. Ashley, anything to add to that, some perspectives?
I totally agree with her. I mean, I do see my post-delivery patients like up to 6 weeks. That means I do give appointment after that, because to check on them. Right, to check on them not only after delivery, looking at their ovaries, looking at their uterus and their wound or their scars, but the mental stress and the mental development they are going through, which is very important. So I will always have a small chat with them after deliveries. I mean, like in the clinic sessions, to check how are you coping with your breastfeeding, how are you coping with your babies and all that. Is there any issue with your babies that that we can help further, or do you have any problems with breastfeeding, or sometimes the milk supplementation, and sometimes diet-wise, and she feels that she has no attention to herself, she loses herself. And she has no confidence, and to get back to work is another stress for her.
Yes, postpartum depression as well, whether it can be identified on time, right?
Yes.
Absolutely. So Dr. Ashley, I'd like to go a little bit deeper into how actually, now we do have increasing recognition and awareness amongst the general public of fertility clinics as well as obstetricians. Now, how can it be all well integrated together as a system so that age-related infertility clients who are coming in, women and their husbands and couples, and integrating it into a comprehensive diagnostic approach, something that is perhaps streamlined across the country, especially given the risk factors that are quite commonly known for most Malaysians?
All right. So it's a very good question that we want everyone out there to know, that if you are trying to conceive, so first of all, you must know your body. All right, you must know what is going on. So early screening about any comorbidities like diabetes, hypertension, any thyroid issues, okay, that we need to address. All right. If you have abnormal uterine bleeding, if you have abnormal bleeding periods, prolonged bleeding and things like that, we need to check whether is your uterus doing good, whether is there any abnormal changes at the lining of the cell, or any abnormal condition of the ovaries that we can actually do a simple investigation like scans. And some
the
blood
AMH
tests.
that you mentioned earlier.
Yes, some blood tests to assess the patients, male and female patients. All right, you come in a group, as a couple, and after that we will also, once we embark her in pregnancy, for example, if she is going through IVF. So we do have a lot of advanced technology to help us on this. We know that age is also another factor that contributes to abnormal fetus, abnormal babies in future. So we want to screen further. If let's say we go towards IVF treatment, so we do have certain investigation, like for example, the pre-implantation genetic testing, where we can actually check on the embryo cells and to check whether is there any chromosome issues, like for example Down syndrome or any genetic disorder that carries in the family, like for example if both parents are thalassemia carrier. And we know that if, like for example, both parents are thalassemia carrier, their babies has 25% of inherit what we call as major thalassemia, where the baby will be at a very high risk in future development.
It just basically helps facilitate informed decision making.
Yes,
perhaps.
yes, yes. So we can know it earlier, even before you get conceived.
Sure.
So we can know whether if the baby has any issues, any chromosomal problems, any genetic disorder prior to conception. So we would have a testing on the embryos before we put the embryo back into the uterus for conception. So we might actually stop the hereditary line at that generation, like for example, thalassemia carrier.
With that advance actually. Now, do you actually see couples taking that choice in some of the cases that you have dealt with?
Yes, we do have the perception that maybe like 40, 50 years ago, we say that, okay, thalassemia carriers, you are not advisable to get married. Because
At
we
all,
don't want, we don't want that inheritance.
That's no longer true today,
yes,
right?
it's no longer true. So, I mean, true love, who actually screen for thalassemia before you fall in love?
Sure,
no, we don't. So, we do have couples who come in, like alpha thalassemia carrier, both parents. I mean, like, beta thalassemia carriers. So we want to screen. We want to screen, even though some came in, they're already pregnant in their first or second trimester.
Right, understood.
So thanks to Gayatri, I have her to help me with that, because we can screen the baby by doing an amniocentesis.
Diagnostic testing.
That's right. Yeah.
We take some fluids around the baby and check. And from there, we can actually prepare the parents of what are we looking at it next. What are the possible implications that we are looking at it, during antenatal, and possible outcome after delivery. And we can get in our pediatrician colleagues to help us with counseling, with possible care after delivery.
Exactly. And perhaps this needs to actually be a consideration for those who are planning on starting their families later in life, regardless of whether or not they are already aware of genetic risk factors, right?
So adding on to this topic, so
sure.
Like you're mentioning about genetic conditions, about, how they prepare. So when do these women actually, who do they seek when they come for treatment? We know women 40 and above have difficulty conceiving, or is their medical condition that makes them more susceptible to difficulty conceiving? So they might come straight to see a fertility consultant like Dr. Ashley, or they'll come to me, to have a preconception. So working hand in hand and, discussing what we can do at the very get-go is essential. Because you see, not everyone is going to go and say, you know what, I'm going to go and check myself with the doctors. And some women, we tend to, if we can't meet them in the preconception, we see them early in the pregnancy. So I think we should grab that opportunity to screen and intervene early. Again, early detection, screening, we intervene early for a better outcome for both mom and baby.
Exactly. So earlier as possible, but also perhaps even before people decide to get pregnant, right? Timeline-wise, what would be the appropriate timeline, Dr. Ashley, for couples who are planning at some point, but they know it's going to be at a later point in their lives that they will conceive, to start actually getting all your risk factors in line? That means looking at whether or not you're in an urbanized situation, what are your lifestyle risks, and how you can actually start working on them. What should the time frame be?
Okay, I wouldn't set a specific timeline, but I would suggest that if you are 35 and below, and you are trying for at least a year, or you're planning maybe ahead later on, a year later, get yourself checked, just to make sure that everything in line before you are really embarked on your pregnancy. Like for example, if you are irregular periods, then maybe you want to know whether is there any issue with your ovaries, whether do you have any PCOS, whether do you have any ovarian cysts that hinder your regular periods, or if you have pain during periods, that we want to know whether you have endometriosis that we need to operate on. So if you have surgeries on your ovary, or especially on your uterus, we want to know when is the best time for you to conceive. Like for example, if you do have a fibroid surgery done on your uterus, so then we would say that the timeline to conceive may be 6 months or 1 year after the surgery. So that will be good for us to prepare you ahead.
Right.
At least a better contraception, instead of you get unplanned pregnancy and the possible outcome will be even more disastrous. So we want to prep beforehand. So if you're 35 and above, then we will know that the quality of eggs and the number of eggs will reduce tremendously. So we will want you to probably start yourself on some supplements, healthier lifestyle, some regular exercise, maybe some diet control with, reduce processed food. Those sweetened food will also cause aging advance faster. So we want you to get yourself more prepared. If let's say you're 35 and above, you're trying more than 6 months or about 6 months, please get yourself checked just to make sure that everything is in line.
Absolutely. And perhaps just before we end out, Dr. Gayatri, I'd love for you to perhaps share with us a little bit on your perspectives on the term which is quite common for pregnancies above 35, which is geriatric pregnancies, and how hopefully we can move beyond the stigma of getting and becoming pregnant and having a healthy pregnancy later in our lives.
Okay, I think that's an excellent question, how to, sum all what we are discussing today.
Sure.
So I think geriatric pregnancy, it's not a very nice term. And we should not stigmatize these women. we should have normalized this conversation. Make the woman feel comfortable before she's pregnant or during pregnant. You know, it's not nice to say, hey, you're already 45, you want to get pregnant now, how are you going to run after your children when you're 50? You know, I mean, that's not nice. I mean, it's her choice. But it goes back to that we have done the counseling, we have discussed together with the patient. It's a shared decision, and she's aware that, you know, embarking on a pregnancy after 40, there are risks, like I mentioned earlier, you know, difficulty conceiving, miscarriages, your diabetes, high blood pressure. And she's aware of all those risks, and she makes an informed decision.
And you've been screened and we know we plan condition.
And, you know, we do a proper planning. We, as the doctors, should support and ensure that mom and baby have a safe and successful pregnancy outcome.
Absolutely. Dr. Ashley, any last thoughts on destigmatizing pregnancies and fertility above 40 as well?
Yeah, I agree with Dr. Gayatri. I mean, like, you have to remember that you are not alone. You are not alone carry your baby at 40 or after 40. So we are always here to help to make sure that you are a healthy mother, because you want to have healthy baby. All right. So a healthy mother means that we want you to be taken care properly. We want everything to be at par. If you have any condition, we want you to screen early and we'll treat early. All right. So prevention is always better than cure. So we are all here, hand in hand, multidisciplinary approach, shared care, and we know that everything will be much better. And the most important thing is healthy mother, healthy baby.
Healthy mother, healthy baby, indeed. Yes. Thank you so much. It's been a very interesting conversation. And of course, I think it helps re-emphasize that not just early intervention, but hopefully positive outcomes. And looking at the statistics and demographics that we have of, you know, women over 40 delivering 6.0% of live births in the first half of 2024, perhaps with less stigma and more support and more awareness, we can push up that figure to even a 10%. And that will definitely help with looking at addressing depopulation and more. Thank you very much, Dr. Gayatri. Thank you very much, Dr.
Thank you very much.
Thank you.
Well, that's all we have time for today on Niaga Spotlight. I'm Tehmina Kaoosji, and we'll be back next Friday with more economic analysis and insights. Here's to a productive week ahead.